A very good morning to one and all. This is Dr. Jyotirmay, consultant gynecologist and fertility specialist from Avira Hospital. So today we are going to discuss about postmenopausal bleeding. First and foremost, what is menopause? So whenever a woman does not get her periods for about 12 months of period, then we say that the woman has reached her menopause. So what is the average age when a woman will reach the menopause is that it depends upon the ethnicity. In the Western countries, it is about 50 to 55 years, and in India, it is 2 to 3 years less than the Western countries. Now, what is postmenopausal bleeding? Postmenopausal bleeding is nothing but whenever a woman has reached her menopause and any amount of vaginal bleeding which we see is called as a postmenopausal bleeding. And what are the most important causes of this postmenopausal bleeding? First and foremost is the senile vaginitis. So what is the senile vaginitis? So normally the vagina is moist and it is healthy because of the hormones secreted by the ovary. In postmenopause, what happens is that the ovaries are silent and they will be not secreting any estrogen or progesterone hormones. Because of that, the vagina will be becoming dry. So any amount of blunt trauma will be leading to the bleeding, and this we call it as a senile vaginitis. So for the treatment is that we can prescribe any local estrogen gels to the patient. And the second and the most important cause is that any cervical lesions, that is the most important, is the cervical carcinoma. So if a woman presents with any foul smelling discharge along with the postmenopausal bleeding, she should be evaluated thoroughly because this is the age group where we can see the cervical carcinoma. So we have to take an appropriate biopsies and the patient should undergo MRI to know the extension of the disease. So depending upon the stage of the cervical carcinoma, the treatment varies. Any stage of cervical carcinoma is radiosensitive. And the other important cause for this postmenopausal bleeding is the endometrial lesions. Endometrial lesions, among these endometrial lesions, we are having polyps and endometrial hyperplasia or endometrial carcinoma. So endometrial polyps are not that common as a young woman, but which are very rare. And coming to the endometrial hyperplasia or endometrial carcinoma, ultrasound to be done in such cases, and whenever the endometrial thickness is more than 4 millimeters, she should be evaluated, she should undergo the biopsy, and then the treatment depends upon the histopathological examination of the biopsy. So for the treatment for this endometrial carcinoma is that it is a staging laparotomy. Along with the staging laparotomy, we have to remove the entire uterus, allowing the fallopian tubes and both the ovaries. And next important cause for the postmenopausal bleeding are the ovarian carcinomas. So same as an endometrial carcinoma, ovarian carcinomas we are going to treat by staging laparotomy. We are going to remove both the ovaries along with the fallopian tubes and the uterus. So depending upon the stage, even she might require chemotherapy also. And the rare but other important cause is the uterine sarcomas. Here the treatment is a hysterectomy. So even the postmenopausal bleeding, it seems to be simple, but the treatment varies depending upon the stage of the carcinoma. So any amount of postmenopausal bleeding should not be neglected and should be thoroughly evaluated. For further queries, contact us. Thank you.